We're coming to you from the set of Cougar Town, the hit TV show on ABC. Of course, we're joined by its star, Courtney Cox, and we're here to talk about a genetic condition. It's called epidermolysis bullosa. Did I say that correctly?
Nope.
You say it for me. You say it for me.
Yeah, I will. It's not an easy one. It's called epidermolysis bullosa.
There you have it, and it's EB for short. Tell us about the condition.
It is, like you said, a genetic disorder that affects your skin. There's a gene that's missing in the layers of the skin that doesn't allow the skin to adhere to itself.
I just wish that every day people knew exactly what EB was and how it affected us.
Other people that don't really know, they kind of stare and point and laugh and stuff. And of course that gets to you, but it's happened all my life. I don't, you know.
EB is a high maintenance life that you do not choose to have. Because every minute of every day you are constantly in your head revolving. Can I do that because my EB might affect it, or can I eat that? Can I just do anything? Am I too tired to do this?
We really want a cure. It's really hard living like this day by day, so we really want and need a cure. And we always have hope, but we need the funds for doctors to be able to do whatever they need to be able to find that cure.
Epidermolysis bullosa is a relatively rare disease. Approximately 200 babies are born with EB in the United States each year. But when you've seen it, from the young friend of a famous actress to a kid in a wheelchair in a high school choir, you don't forget it. It can be so challenging, so painful, that it's hard to fathom.
At a very simplistic level, you can think about the skin as more or less being comprised of two layers. There's the top layer called the epidermis, and then the bottom layer is called the dermis, which is more or less made of connective tissue. EB is a disorder in which the proteins or the little connections that hold those two layers of skin together don't function normally. So you could kind of think about two pieces of Velcro. Normally, if you're trying to pull on that Velcro, it doesn't come apart. But if the little loops in the Velcro aren't working properly, you can see how the Velcro would come apart. That's sort of like a blister that a patient with EB would get. So the three main types of EB are called EB simplex, junctional EB, and dystrophic EB. And the dystrophic form is typically one of the most severe forms. And part of the severity is because those deeper blisters heal with scarring, and that leads to a lot of long-term problems for these children.
Some of the problems and complications include anemia, loss of hand function, difficulty swallowing, malnutrition, cardiomyopathy, loss of mobility, infection.
Hi, I'm John. I have a disease called epidermolysis bullosa, EB for short, and it's really hard to deal with sometimes. I have wounds all over my body, and we have dressing changes. Then we do a bath, which is I get in the tub, I soak my back, I soak in there to get everything wet so it's not stuck when it comes off.
One of the major issues that we deal with in caring for the children is reducing pain. And one of the major sources of pain is around bathing. Here you have the mother or the father who's the protector, but they're also at times the torturer.
And it's very difficult to think that that's what you're doing to your child in order to keep them safe, in order to keep them clean, in order to keep the infections away, that it's just an everyday routine that comes with EB. It's the hardest thing in the world when your daughter says, "Daddy, stop, you're hurting me." It's never something you would ever imagine.
My hands, my hands aren't that good, All I ever wish for is not to have EB. I mean, I'd be able to do everything. I mean, to walk or even just hold anything, I just think about that all the time, and sometimes, when I think about it, it makes me so sad, everything that I can't do.
But there is something you can do. You can help support promising research. This is an incredibly exciting time in EB research. We're on the cusp of finding a cure, with work progressing in cell therapy, gene therapy, and protein replacement therapy. Your help will make these therapies a reality. You can help financially struggling EB families. Care is so expensive, even beyond insurance, and often one parent has no time for a paying job. And you can help the children by supporting special EB camps where the kids can go and really be themselves. Getting involved is easy. There are organizations that provide funds for research and services for EB patients, such as DebRA of America, the Jackson Gabriel Silver Foundation, the Butterfly Fund, Children's Hospital Colorado Foundation EB Family Assistance Fund, and the Epidermolysis Bullosa Medical Research Foundation. You can help.